For pregnant women, they may have a little higher dose, which is about 400 micrograms. And we often pregnant women will ask you that small yellow tablet, does it contain enough of the folic acid? And the answer is yes, because one of that folic acid tablet is 5 microgram, 5 milligram, which is equivalent to 500 microgram. And the body needs, pregnant woman needs about 400 micrograms. So you have excess folic acid in just that one tablet of folic acid that they take on a daily basis. Also, the iron tablet is 200 milligrams. One tablet of the iron medicine is 200 milligrams, and the body needs about 40 to 59, some approximately 59 milligrams of iron on a daily basis for those that have the normal hemoglobin concentration. So that tablet of iron that is 200 milligrams has enough iron supplements to keep the pregnancy on a daily basis.
Hello, sir. Okay, I beg your pardon, just trying to reconnect with my guest so we can round off this conversation, so he can, talk to us about the other aspects and, all the stuff that we're talking about as it relates to anemia in pregnancy. Well, so far, he has also talked about the causes, what could lead to that anemic condition for a pregnant woman. And he said lack of iron, lack of folic acid, and then I have him back here. Hello, sir.
Okay.
Good to have you back.
So, yes, so we can continue, right?
Yes, we can.
Okay, so we mentioned some of the acquired causes of anemia in pregnancy, which is under infection. Say malaria, infection or infestation can lead to anemia. And malaria goes with fever. Yeah. And how is the explanation? Fever actually reduces the appetite of pregnant women and may also cause hemolysis, breakdown of the red blood cells, and also impaired absorption of iron and nutrients from the intestine of the pregnant woman. And also urinary tract infections can also be a cause of anemia in pregnancy. Transfusion of mismatched blood can result in a hemolysis, breakdown of blood cells, and cause anemia in pregnancy. Then bleeding conditions in pregnancies, we call hemorrhagic conditions, blood loss in pregnancy, threatened abortion, and inevitable abortion, unsafe abortion, whereby the caregiver may not be skilled and begins to cause a trauma to the lower part of the uterus, that is the cervix, lacerate the cervix, or may even cause a perforation of the uterus, resulting in blood loss and invariably anemia. Then ectopic pregnancies too can be a cause of anemia in pregnancy. Pregnancy that is implanted outside the normal uterine cavity. And then we talk about antepartum hemorrhage. Antepartum hemorrhage of the placenta previa, the usual location of the placenta, implantation of the placenta in the lower uterine segment can cause bleeding during pregnancy after viability in our environment 28 weeks. Then abruptio placenta, premature separation of the placenta can also cause bleeding and anemia. And then sometimes too, women may have uterine rupture women that are not properly supervised during delivery, or women that have been operated and they are not also compliant with antenatal visits, or they indulge in some unsafe obstetric procedures such as abdominal massage and cause uterine rupture. And also other causes may include hookworm infestation. Hookworm infestation of the pregnant woman. The common one we know is the Ankylostoma duodenale, whereby the hookworm inserts or puts his mouth on the intestine of the pregnant woman, the small intestine, the duodenum, and begin to take in blood from the intestine of the pregnant woman. Another worm in that category is the Necato americana, and also type of worm that can cause
anemia
in pregnancy. And we also have problems with the bone marrow, suppression of bone marrow, cancers of the blood, aplastic anemia. And we have under the miscellaneous causes of anemia, HIV, AIDS, being that are necessary and large, and splenomegaly. Then very important, because when we are discussing anemia in pregnancy, it's also good to look into the socio-economic causes of anemia. Illiteracy and poverty. There will be work done by this foundation in the Ogoni community, and in the introduction of that work, we mentioned that due to illiteracy and poverty, the prevalence of anemia in that community, published by one of the international journals, was 84.1%, far higher than even the range of anemia in developing countries, which is 32 to 53%. So we highlighted that the illiteracy and the poverty in that community, some of the health centers in Ogoni, was a little bit worrisome. And therefore, we put our hands together and also see how we can bring awareness, and also bring about a solution to the reduction in the prevalence of anemia. And we also highlighted that multiple pregnancy, low status of women. Some women have 4 or 5 babies they deliver every year. It will be social aspect, it will be addressed.
And then it affects the blood condition.
Of course, they have not recovered from the stress of the previous pregnancy. They delivered in 2020.
All the entire process, for 9 months, and then the delivery itself, and then one gets pregnant again, within a short period.
So you see a woman that has 3 children in the space of 3 years, how will she recover? There is no job, husband is not working, no source of livelihood. She doesn't have enough to take care of herself, not talk about carrying the 4th pregnancy. So that is a very, very big factor. I've used so many big medical terminology. It's good to begin to address them in the terms and languages they can understand. And that is try to make them to use family planning method, introduce them to family planning and child spacing, not for them to have children every year. As I miss the big grammar being spoken, if we can go home with this, that women should space their children. Women should be empowered. Women should be educated. Primary level, secondary level, they should be educated. Because the woman that is empowered, just like you, a woman that is educated, it's easy to pass information. It's easy for them to comply with medication. It's easy for them to attend antenatal classes. It's easy for them to ask questions intelligently. What are the options for me to prevent anemia?
True. Talking about options to prevent anemia, what other practices, could predispose women to anemia? You have mentioned, you've mentioned some of them, but here I'm thinking, because you mentioned some of the causes include lack of iron, lack of folic acid. So I'm thinking maybe certain practices, maybe not taking the drugs given to them during antenatal, and poverty and lack of education, should I say illiteracy, could actually be contributing to this factor as well, like you have said.
They may not be compliant to medication.
Okay.
Some of them due to
ignorance.
Some of them may also be due to finance to purchase those drugs. As simple as it may be due to.
But these drugs, antenatal drugs, are even given for free in the hospital once you get registered as a pregnant woman.
Well, there are different registration fees. Health centers talk about 5,000. Some of the general hospitals and government hospitals, federal level, and they have moved their antenatal fee from 20 to 30,000 naira.
Wow!
And, how many people can afford that? And of course, you have to do scan in between. Some of the private hospitals, antenatal fees are far higher than that. So when we talk about that, we talk about minimum wage. I don't know what the minimum wage. The last time they were talking about 30,000,
which has of which some state governments are not able to pay until now.
Yeah, which is under debate. Some few states have been able to pay. I know Rivers and the Lagos State and some other states are paying the minimum wage, but across board, it's still not easy. And to add to that, some pregnant women also pay for, we call it PICA. PICA, you have heard about the Unzu native chalk.
Yeah.
So they go after consuming of some of those substances which are not supposed to be taken in a pregnancy, and those
they are not supposed to be taken. Let me come to that. Unzu, as we call it, is not supposed to be taken during pregnancy.
Even outside pregnancy is not even good because
okay, but a lot of I kind of think a lot of pregnant women crave that thing, So why do they crave for it? Why does the pregnancy make them crave for it if they are not supposed to be taking it?
During pregnancy there are a lot of physiological changes.
Yeah.
Hormonal changes too that make the pregnant woman act in the way she shouldn't act. Mm-hmm. And they begin to crave. Some of them crave for ice blocks. Some of them crave for plantain in the middle of the night, roasted plantain, which you have to get for them.
Yeah.
And some of them crave for the unzu. Mm-hmm. The other ones are not bad if you crave for plantain and fishes, but the unzu or the native chalk is a chelating agent. In fact, one of the pregnant women I attended to, I've asked her volume was about 30%. In the space of about 2 weeks, it will drop to 21%.
Wow.
And when I proved for them, I now discovered that she was taking the native chalk. It dropped from 30% to 24% in the space of about 1 week. Then in 2 weeks, she was complaining of dizziness, tiredness, headache. So we repeated the blood level, and it was 21%. That's when she now opened up that she takes Unzu, which is a chelating agent. Okay. And by the time she stopped, it took a while, within about 2-3 weeks, it was now building up with supplemental iron.
Okay.
The folic acid, the folate. So she now began to build up, and it simply tells you that the Unzu was the cause of her anemia.
Wow.
The Unzu was the cause of her anemia. And if there is another important point you are driving it, that pregnant women should not take substances that are not good, recommended in pregnancy, because that can be the source of anemia in pregnancy.
And they may not even know until it gets late, which is why it's important for pregnant women to go for antenatal and be checked regularly. Exactly.
Even in the antenatal care, some specialists and obstetricians have advocated that we repeat the blood level every trimester. First trimester 13 weeks, second trimester 26 weeks, and third trimester 28, 32 weeks. We should always do their partial volume or hemoglobin concentration. And pregnant women also should be compliant to their iron medication, folic acid, and anti-malaria. You highlighted that malaria infection or infestation
is one of the causes.
aspect of anemia. So the World Health Organization has programmed the antenatal care that they receive malaria prevention or prophylactic anti-malaria, that is the sulfadozine pyrimethamine, commonly called Fancida. At least 2 doses spaced 4 weeks apart or 1 month apart after quickening, after the woman begins to feel her baby.
Kick.
And most times we give it as 18 weeks for the old timers. They feel their baby earlier compared to the new timers, the primary gravida. Those ones feel their babies at 20 weeks. So we commence the malaria prevention at 18 weeks together with the at times with the tetanus injection at 4 weeks apart.
Okay.
4 weeks apart. Then we also talk about improving the health status of our pregnant women. They should eat well. I think some cultures normally after the husband has finished eating before the wife should eat. It's not like that.
Like so, people do that. The husband needs to eat first before the wife eats. Really?
Of course, before the wife eats.
Even if she's not pregnant, I mean that's strange. Yeah, people do things anyway.
Yeah, so that's the importance of this program too. So we should tell them that we should improve the general health status of women and improve their socio-economic status. Women that have some kind of jobs that are empowered too will be able to take care of themselves better than just dependent on their husband wholly and totally. I know some people may not agree with me that women should be locked in the house, but I think a woman that is empowered gives her leverage to be able to learn and able to be taught 1 or 2 things that will influence her life positively.
Okay. Great. Yeah. Can we also now go to the implication? How does this, what's the implication of this condition on the pregnant woman, both on her and the baby in the womb?
Okay, the complications of anemia in pregnancy, you have already classified it into the maternal and the fetal or the baby.
Yeah.
For the mother, malaria in pregnancy can cause or could cause miscarriages. In the first 13 weeks, when the woman loses her pregnancy, we call it a miscarriage. It can cause miscarriages. Then as the pregnancy advances too, it can also cause problems with the heart disease in pregnancy can surface when the woman has anemia, and the end point of that heart condition is cardiac failure, and of course maternal death or maternal mortality. It's documented from the literature that anemia in pregnancy accounts for about 30 to 50% of women that die during pregnancy. So it's a grievous disease in pregnancy, and it can also cause problems cause problems for lowering of immunity, and that can now predispose the woman to urinary tract infections too. In pregnancy, and even after delivery, you have what we call puerperal infection. After delivery, the woman has problems. You have offensive discharge from her genital tract because when there's anemia, low oxygen carrying capacity, the woman begins to have fever, begin to have discharge that are offensive. Then it can also make some of those dormant infections to resurface in pregnancy. For example, tuberculosis, salmonella, which is so common. People make the diagnosis of typhoid, salmonella infections, and amoebiasis also. And anemia also can, in addition to that, can impair wound healing. Women that have episiotomy during delivery, cutting of our genital to increase the diameter of the vulva in order for the baby to be delivered. After giving of episiotomy and repairing, due to reduction in the oxygen carrying capacity, there will be impairment in healing of the episiotomy site, together with those that have uterine sections too. So you see women that have problems with wound healing,
after
despite they are being
pregnancy,
given antibiotics, yes, they still have
anemia.
wound healing problems too. Then women that even breastfeed, lactating mothers, you find it difficult. You discover that they may also have problems with the lactation, because there is a relationship between the blood flow and the production of breast milk. So that's on the pregnant woman. For the baby, malaria in pregnancy can cause low birth weight. You see the baby not thriving well. A baby that's supposed to be 8 months in the womb appears as if it is as if he or she is 6 months or so. So there may be a disparity in the growth of the baby due to anemia, and it can cause preterm labor. Because the baby is not getting enough nutrients. You know that whatever the mother takes in, how nourished the mother is reflects on the baby.
Yes, it affects the baby.
Yeah, through the placenta, it can cause preterm labor, can cause intrauterine growth restrictions. I had mentioned abortions earlier in the first and second trimester. Then it can also cause stillbirth, intrauterine fetal death after the baby goes through intrauterine growth restriction. The growth in the baby is restricted, and if care is not taken and drastic measures are not taken, the baby dies inside the womb. And you know that is quite pathetic too. Yes. So those are some of the explanations of the effect of anemia, both to the mother and to the baby.
Time is not exactly on our side this morning, but it wouldn't be fair if we don't look at how we can prevent this condition / treatment. I think both could go together. If it either can be definitely, I think it should be able. We can prevent it, yes, definitely. And then treatment in a situation where a pregnant woman is already anemic. Maybe we can do that in a couple of minutes, just a few minutes, sir.
Okay, and the prevention of anemia is mainly by encouraging the pregnant women to be compliant with the antenatal care, medication, and visitations too, because they will be able to detect their blood
on time.
level on time. Yes, and we didn't talk about the classification. You have the mild and the severe anemia based on the classification, or the mild, moderate, and severe anemia. Some of the classification is based on if it's mild anemia, between the less than 10 to 7 grams per deciliter, we can give them prophylactic iron and folic acid. We double the dose. If they have to take one, we now say you have to take one morning and one evening. Then if it is less than that, by 6 grams, of some researchers say if it's 5 grams or so, or some others say if it's 24%, below 24%, there is room for blood transfusion before labor. Then we've talked about improving the general health of the woman. They should eat well. Nutrition is one of the commonest causes of anemia in pregnancy. So they should eat well. There are some diets that are rich in iron. You have the plantain and folic acid. You have the spinach. You have diets that we will encourage them to take: bananas, mushrooms, vegetables. Diet rich in vitamin C, copper, and cobalt, and liver, meat. All those ones we will encourage them. We have fish to take them a lot, and to avoid some of those drugs when you're taking an iron supplement. Researchers have talked about eggs forming a complex with iron, making it difficult to be absorbed. Cow milk also. Some researchers have said that it's not too good for pregnant women too.
Okay, so you just said milk, right? And egg? Is that what you said?
Yes, that they form a complex with the
iron.
With the iron. So
Okay, so pregnant women should avoid taking too much of milk and eggs. Oh, well. All right, but it's
And
actually
it's very dangerous.
okay. Yes, please.
It's
Can you
dangerous.
just repeat what you said because I didn't get
So,
that because of network. What did you just say?
okay, I mentioned that there are some food substances that encourage iron
Yes, and that includes milk and
intake,
egg.
but in egg, the yolk of egg, researchers say that it forms complex with iron, making it difficult for iron to be observed. So we can't make a sweeping statement that pregnant women should not take egg. No,
But
we
they can
can't do
avoid
that.
the yolk.
The yolk, yes, we can avoid the yolk. So
Okay.
they should take yam, mushroom, banana, vegetables, and the rest. So
Okay.
those are food substances. Then pregnant women also should be educated. They should try and have formal education. And we talk about eradication of illiteracy. I use the
All right,
Ogoni
sir.
case study
Yes.
for this. So health education, which we are doing, is very, very important, which is also given during the antenatal care.
Yeah.
There are lectures that are reserved for well-being of the pregnant women to achieve carrying the pregnancy to term and also delivering a healthy baby to a contented or satisfied mother.
Thank you so much, sir. You have been so helpful this morning. Thank you. God bless you, sir.
My pleasure, yes.
Okay. So I have been talking with Dr. Eli Sokarime. He's a consultant, obstetrician, and gynecologist. And today we have been talking about anemia in pregnancy. Running off actually right now because of time. And I'm supposed to do a commercial before it's news time at 12. So, all right, if you can actually get through to me, I'd like to get your reaction to this. Okay. I actually also said you could send questions or just call me up very quickly. Let me get your reaction. To what we have talked about today. I'm pretty sure you learned a whole lot. I don't want to say something. You learned a whole lot, whether you're pregnant, planning to get pregnant, if you're currently pregnant and you're having certain symptoms, you have questions. Pregnant women have, questions a lot because they're always monitoring their body, the baby, how the baby is responding and all of that. Pregnant women are quite careful. Responsible pregnant women are quite careful what they eat, okay, and how they take care of themselves because whatever they're doing would affect the baby. If I could just get, say, 2 calls, I really don't mind because of time. Or you can call me up on 0705 079 1021. If there's anything that you need some clarity on, you have a question to ask, you want to make a contribution, you want to let me know how the program today has affected you, what you have learned so far, I'd like to hear it. Call me up on 0705 079 1021. That is 0705 079 1021. And the other number to call is 081 174 31021. That is 081 174 31021. Join me live on Facebook. Well, I believe you have been watching anyway. Okay, so I believe you're live on Facebook. You could drop a comment under the live video. That's at Super FM PH, Super FM 93.3. And it's actually about time for me to step aside because of my commercial break. I really do apologize for not being able to, get reactions from you today. It's not my practice normally. Okay, it's just because of time. And my guest today on the show had a lot to cover. And so he had to just, take his time to break everything down for our own good. So this is why I get to say thank you so much for your time today. All right, thank you. And please do well to, if you're pregnant and planning to get pregnant, do well to adhere to all of the rules. Go for your antenatal. Take your antenatal drugs. Make sure you're going for regular checkup when you should, all right? And if you have no plans of how to take care of yourself when you're pregnant and the baby, maybe you should put a pause on the thoughts of getting pregnant because you don't want to have a stillbirth. You don't want to lose your life. You don't want anything to go wrong while you're pregnant. You need to take good care of yourself and the baby if you're pregnant, all right? Thank you so much for your time. A commercial break comes up next.